Cytomegalovirus, or CMV, is a common infection many people will contract during their lifetime. In the United States, 1 out of every 3 children get CMV by the time they're 5 years old. Fortunately, most adults and children who get CMV will not get very sick. Some may have mild symptoms like sore throat and fatigue. Many will experience no symptoms at all. This means that most of the time, people have no idea they were infected with CMV when it happens. CMV is a virus in the herpes family. Viruses of this type are known for their ability to establish lifelong infections in their hosts. Once a person has CMV, they can pass the virus to others at any time. In spite of this, CMV is not considered highly contagious. The virus is usually spread by direct contact with the urine or saliva of an infected person. While the virus is mostly harmless for children and adults, CMV can cause serious problems if babies are infected while they are still in the womb. This is called congenital CMV and happens when a pregnant mother passes the virus to her fetus. Congenital CMV can occur if the mother already had CMV and the virus reactivated, or she got a different strain of the CMV virus during pregnancy. The fetus can also be infected with CMV if the mother is exposed to the virus for the first time while she is pregnant. About 40% of women who have their first CMV infection during pregnancy will pass it to their fetuses. Babies born with CMV can experience a wide range of outcomes. Most babies born with CMV have no visible signs of the infection. That is, there isn't anything about the way the baby looks or acts that would suggest they might have CMV. Of these babies, 10 to 15% develop hearing loss. It might be present at birth or not show up until later in life. Hearing could be lost in only one ear or both ears. The amount of hearing loss can also get worse over time. Some babies born with CMV have visible signs, such as small body or head size, yellow skin color, or a rash that looks like purple dots. Many of these babies also have hearing loss that will get worse as they grow older. They may also have loss of vision, intellectual disability, muscle weakness, and seizures. Severe cases may even result in death. How congenital CMV is diagnosed? Most cases of congenital CMV go undetected. Pregnant mothers rarely show signs of having CMV, and most babies born with CMV don't have obvious symptoms. Newborns are routinely tested for a variety of disorders for which early treatment is beneficial. But CMV isn't one of those tests. Different states have different triggers for CMV testing. In some states, if a baby is born with visible signs that might be CMV, they are given a CMV test. In a few states, babies who fail the routine newborn hearing test are tested for CMV. How congenital CMV is treated? If a newborn has visible symptoms and tests positive for CMV, treatment is started with antiviral medications as soon as possible. These drugs do not make the virus go away, they only slow its growth, which keeps symptoms from getting any worse. Newborns who test positive for CMV but only have isolated hearing loss receive early hearing intervention services. They are carefully monitored throughout childhood in case abnormalities develop. They may also be candidates for hearing aids. There is no consensus on whether infants with isolated hearing loss would benefit from antiviral medications. Congenital CMV can be prevented. Women who are pregnant or planning on becoming pregnant can lower their risk of CMV exposure by following some simple guidelines. The virus spreads by direct contact with the urine or saliva of someone with CMV. That's why pregnant women often get CMV from their own child or a child they are caring for. CMV can live for up to 15 minutes on items outside the body. Pregnant women should wash their hands with soap after changing diapers, blowing noses, or touching toys and pacifiers. Pregnant women should not put things in their mouth after they've been in a child's mouth. This includes shared food, cups, straws, eating utensils, toothbrushes, and pacifiers. Kissing children on the lips should be replaced with forehead kisses and hugs. Here is a summary of the things you should know about CMV. CMV is a common infection that many people will contract during their lifetime. While the virus is mostly harmless for children and adults, CMV can cause severe health problems if babies are infected while they are still in the womb. Babies born with CMV can experience a wide range of outcomes. Most babies born with CMV don't have any symptoms. Some babies born with CMV have hearing loss and experience no other symptoms. Some babies have visible signs of congenital CMV. For these infants, treatment is started with antiviral medications as soon as possible. Congenital CMV can be prevented. Women who are pregnant or planning on becoming pregnant can lower their risk by avoiding contact with the saliva or urine of children. CMV causes the most congenital disabilities of any virus. After hereditary conditions, it is the leading cause of childhood hearing loss. Yet stunningly, most people have never even heard of it. Awareness is key to prevention. You can help by sharing what you know about CMV with your friends and family.